Sometimes I've seen nurses, and they don't have a stethoscope in it, and I'm wondering, okay, then, out of everything else that, we should have had, including our phone, I just think that a stethoscope is very important. All right, hi everyone, welcome to the channel. Thank you so much for tuning in to the Think Nursing channel. So everybody have a cell phone nowadays. Everybody have a cell phone nowadays, and even when we're going to the bathroom, we're going for lunch, we're going for dinner, we're going anywhere, gym, the one thing that we have with us at all times is our cell phone. And even kids are getting into this habit as well, because kids, most of them have a tablet, and it's the same thing. They can't live without their tablet. And so as a nurse practitioner and any job that you're doing, it is the same thing. There is one item that is very, very essential for you in order for you to carry out your job. And when it comes on to you working your job as a house call nurse practitioner or as a nurse, it is very important for us to have this one item or two item to make your day complete. For nurses, definitely you have to have your stethoscope. Sometimes I've seen nurses, and they don't have a stethoscope in it, and I'm wondering, okay, then, out of everything else that, we should have had, including our phone, I just think that a stethoscope is very important. Because how are we listening to, not only the voice of our patients, not saying that we use it for that, but we're listening, we're auscultating. How are you listening for those vowel sounds, heart sounds, the breath sounds? How are we doing that? And without a stethoscope, that is not possible. And assessment is very, very vital. Assessment is so important when it comes on to, the evaluation of the patient. So if you don't have a stethoscope, how is it that we're saying that we're nurses? You definitely need a stethoscope. So I find it odd sometimes that, a lot of times I see persons and they don't have a stethoscope. You come into work and you don't have a stethoscope. I just think it looks bad on us because, I just feel like it just looks real bad on us. So that is one thing that that every nurse should own. Every nurse should have a stethoscope and should be walking at least with a stethoscope. So even if you're not listening to anything during the day, yes, you're supposed to have a stethoscope because it's an assessment tool that is very important for you in your work. But you see, for me, when I go in, I definitely have to have my stethoscope, and I definitely have to have a trauma scissors. I definitely have to have my trauma scissors. There are other things that I definitely have to have with me. A pulse oximeter. I have to have my, my pen light. I have a tape measure. Some persons might be asking, why you need a tape measure? A lot of different reasons. From I was back in Jamaica, I used to have my tape measure. And the tape measure, sometimes you do it for the baby's head. You check your baby's head, you check the length. There's so many things, if we never really have anything to check the wound, depending on the size of the wound, you go ahead and measure it. You're not going to put it down on it though, But definitely I will, have one of those. And I use it for different things. So it's not only, to measure clothes. We use it for a lot of things. So I definitely have that as a practice as well. I definitely have multiple pens and pencils, highlighter, a permanent marker, and I definitely have my regular scissors. I also have extra batteries, and I also have a lip balm. Yeah, man, while you're on the work, sometimes your lips kind of look like them chop up. Yeah, man, so I definitely have to get that for my myself. I definitely have to have that when I am working. So those are definitely some things that I don't leave my house without. So I have a little briefcase or a little bag that I walk with all of those. And then the next thing is a clipboard. I always have a clipboard because a clipboard is very important. I definitely have to have my clipboard because when I do, I feel so much more organized with getting my day going. In terms of, prioritize on my board. I use it just for, just a reminder as to, so for example, when I need to do the next blood glucose or the vital signs, or if I need to do something that is not that important right now, I'll put it down, and so as I go along I just mark out. And that is how I just keep my day going with that clipboard. But those are the most important things for me when I'm leaving my house. And my cell phone. Yes, my cell phone. And oh yes, I definitely like to have a second hand, a second hand clock. So even though I have my watch, my phone is one, and then sometimes in the rooms of the patient you'll have those, but definitely my phone is also with me, just like everybody else. So those are very essential to my job as a nurse practitioner. I think it's also essential for your job as a nurse. So please go ahead and tell me what it is that is very important for you apart from your cell phone. What is one item that is very important to you when you're going to work that you definitely cannot leave your house without and, function through the day without not having it? If you have any information or anything to share, feel free to go ahead and leave it in the comment box below. Remember to like, share, subscribe to the channel for more content related to nursing, travel, and lifestyle. Until then, bye.